Imagine a world where more than 350 million people, or about 4.4% of the global population, grapple with a painful condition known as arthritis. This isn't some dystopian fiction, it's the shocking reality we live in. Arthritis isn't a selective condition, it affects people of all ages, races, and genders, making everyday tasks a battle against pain and stiffness. There's a common misconception that arthritis is simply an old person's disease. Let's debunk that myth right now. Arthritis can strike at any age, and in fact 2/3 of people with arthritis are under the age of 65. But what is arthritis really? It's not just one condition, but a complex family of musculoskeletal disorders. There are over 100 different types of arthritis, each with its unique causes and symptoms. From osteoarthritis to rheumatoid arthritis, from gout to lupus, arthritis is more than just a single disease, it's a term covering over 100 different conditions. So, what triggers this widespread condition and how does it manifest itself? Arthritis is not a single disease but a way to refer to joint pain or joint disease, with over 100 different types known today. The root causes of arthritis are as varied as its types, but there are a few common risk factors that could increase the likelihood of developing the condition. Age is a key player. As we get older, the wear and tear on our joints can lead to osteoarthritis, the most common form of arthritis. Don't be fooled though. Arthritis can occur at any age, even in children. Family history is another factor. Genetics can make some of us more susceptible to environmental factors that may trigger arthritis. If your parents or siblings have arthritis, you may be more likely to develop it as well. Lifestyle factors also play a significant role. Overweight individuals put extra pressure on their joints, particularly their knees, hips, and spine, which can lead to arthritis over time. Even injuries can kickstart the process, as damaged joints are more likely to develop arthritis. Now let's talk about how arthritis presents itself. The most common symptoms are joint pain and stiffness, which typically worsen with age. You may notice that your joints feel tender, and you might experience swelling or redness around the joint. A decreased range of motion is another telltale sign, as arthritis can make it harder to use your joints normally. In severe cases, you might even see visible changes like knobby finger joints. But remember, arthritis affects everyone differently, and the symptoms can range from mild to severe. These symptoms can be easy to dismiss, especially in the early stages. You might think the stiffness in your joints is just a sign of getting older, or the swelling is due to a minor injury. But ignoring these signals can allow the condition to progress and potentially lead to more serious damage. It's important to recognize these symptoms early for effective management of the condition. So, if you're experiencing persistent joint pain or stiffness, it might be time to check in with your healthcare provider. Just remember, the sooner you know, the sooner you can start managing arthritis effectively. Living with arthritis can be a daily battle, affecting every aspect of life. Imagine waking up in the morning and feeling stiffness in your joints, making it difficult to get out of bed. Picture the struggle of trying to grip your toothbrush, the simple act of brushing your teeth becoming an ordeal. This is the reality for many dealing with arthritis. Arthritis doesn't only make daily chores more challenging, it can affect one's professional life as well. Remember John, the mechanic we mentioned earlier? He loves his job, but arthritis in his hands makes it tough to handle tools and work efficiently. His story is not unique. Many people with arthritis face similar challenges at work, with the condition affecting their productivity and in some cases, their career choices. Socializing and leisure activities too can be impacted. Take Susan for example. She used to be an avid gardener, but arthritis in her knees has made it painful to kneel and dig in the soil. She's had to give up a hobby she loved, and this has affected her emotionally. Arthritis can also impact relationships. Daily pain and mobility issues can make individuals more dependent on their loved ones for help with routine tasks. This can lead to feelings of guilt and frustration, adding an emotional burden to the physical one. Moreover, the chronic pain associated with arthritis can be mentally draining, leading to mood changes and in some cases depression. The constant struggle can make individuals feel isolated, even when surrounded by people who care about them. But it's not all doom and gloom. While arthritis does pose significant challenges, it's important to remember that these can be managed. People like John and Susan have found ways to adapt and continue to live fulfilling lives. They have learned to pace themselves, take rest when needed, and seek help when necessary. Arthritis can significantly impact quality of life, but with the right strategies, these challenges can be managed. In the upcoming scenes, we'll discuss diagnosis, treatment options, and practical tips for living with arthritis. So stay tuned, because there's a lot more to learn about this complex condition and how to manage it effectively. But there's hope. Arthritis can be diagnosed and treated effectively. Let's delve into how arthritis is diagnosed. Typically, a healthcare professional will begin with a physical examination. They'll check for fluid around the joints, warm or red joints, and limited range of motion in the joints. These physical clues are significant indicators of arthritis. However, physical examination alone isn't enough to diagnose arthritis. Your doctor may also order laboratory tests to get a clearer picture. This could involve blood tests to look for markers indicative of a specific type of arthritis, and joint fluid tests to rule out gout or an infection. You may also undergo imaging tests like X-rays, MRI, or CT scans to get a detailed picture of your joints and the surrounding structures. Once arthritis is diagnosed, the focus shifts to treatment. There's no one-size-fits-all approach here. Instead, the goal is to reduce symptoms and improve quality of life, and the treatment plan is tailored to suit your individual needs and circumstances. Conventional treatments often involve medications. These can range from over-the-counter pain relievers and anti-inflammatory drugs to stronger prescription drugs, depending on the severity and type of arthritis. In some cases, physical therapy can be incredibly beneficial, helping to strengthen the muscles around the affected joints and maintain joint flexibility. If medications and physical therapy aren't enough, surgical options might be considered. This could involve joint repair, joint replacement, or in severe cases, joint fusion. But conventional treatments aren't the only options. Many people find relief through alternative approaches. Dietary modifications can play a crucial role in managing arthritis. Certain foods have anti-inflammatory properties and can help reduce symptoms. Acupuncture is another alternative treatment that some people find helpful in relieving arthritis pain. Remember, the best treatment plan is one that suits your individual needs and circumstances. So, don't hesitate to discuss all your options with your healthcare provider to find the approach that works best for you. While there's no cure for arthritis, you can take steps to manage the condition and improve your quality of life. It starts with understanding that arthritis doesn't define you. It's simply a part of your life that needs a little extra attention. Firstly, maintaining a healthy weight is crucial. Extra pounds can put undue pressure on your joints, exacerbating arthritis symptoms. So consider adopting a balanced diet that's rich in fruits, vegetables, lean proteins, and whole grains. These foods not only help manage your weight, but also provide necessary nutrients for overall health. Next, let's talk about physical activity. You might think that exercise would aggravate your joint pain and stiffness, but that's not the case. Regular moderate exercise can actually help ease those symptoms. Whether it's a brisk walk around the block, a gentle yoga class, or even a dance party in your living room, find a form of movement that brings you joy and stick with it. Adequate rest is as important as regular exercise. Make sure you're getting enough sleep every night. If arthritis pain makes sleep elusive, try relaxation techniques like deep breathing or meditation before bed. These practices can help quiet your mind and prepare your body for rest. Lastly, don't underestimate the power of self-care. This is not just about taking your medications on time. It's about listening to your body, acknowledging your limitations, and giving yourself permission to take it easy when you need to. It's about making time for hobbies and activities that lift your spirits. Whether that's reading a good book, spending time in nature, or catching up with friends. Remember, you're not alone in this journey. Reach out to healthcare professionals, join support groups, and lean on your loved ones for help and understanding. Managing arthritis is a long-term commitment, but with the right approach, you can lead a fulfilling life. In addition to lifestyle modifications, certain products can make living with arthritis easier. Let's explore some of these, shall we? First up, ergonomic tools. These are designed to reduce stress on your joints when you perform daily tasks. Consider ergonomic kitchen tools like knives with easy grip handles or gardening tools that are lightweight and have padded handles. Writing aids, such as pens with a wide barrel, can also make a world of difference. Next, let's talk about heat and cold packs. Both can do wonders in relieving arthritis pain. Heat packs or warm compresses can relax your muscles and stimulate blood flow, while cold packs can numb the pain and reduce inflammation. Remember, it's not a one-size-fits-all solution, so you might need to experiment to see what works best for you. Moving on, joint supports like braces, splints, or orthotic devices can provide extra support and reduce pain. Knee braces for those with knee arthritis, wrist splints for those with wrist arthritis, the list goes on. It's best to consult your healthcare provider to find the right fit for you. Before we wrap up, let's touch on wearable tech. Activity trackers can remind you to stay active, while smart shoes and insoles can provide feedback on your gait and potentially reduce the strain on your joints. Now, full transparency, we're not sponsored by or affiliated with any of the products mentioned. We're simply sharing information that could make your journey with arthritis a bit easier. These products, while helpful, are not a cure-all. They're meant to complement the treatment plan set out by your healthcare professional. Always consult with them before making any changes to your regimen. Remember, these products are meant to supplement your treatment plan, not replace it. Scene script. Don't just take our word for it, let's hear from the experts. From the vantage point of a medical professional, Dr. Susan Reynolds, a renowned rheumatologist, shares her insights. Arthritis, she explains, is not a singular disease. It's an umbrella term for several conditions causing joint pain or joint disease. She emphasizes that early diagnosis and a comprehensive treatment plan can significantly improve the quality of life for those living with arthritis. Next, we have Dr. James Peterson, a physical therapist with over 20 years of experience in treating arthritis patients. Physical therapy, he asserts, can be a game changer for many. It helps maintain joint mobility, improves strength, and reduces pain. He also stresses the importance of regular exercise, even on days when pain levels are high, as movement can actually help alleviate discomfort. But what's it like living with arthritis? For that perspective, we turn to Alice, who has been managing her rheumatoid arthritis for close to a decade. It's not just about the physical pain, she confides. The emotional toll can be heavy too, but I've learned to adapt and find strategies that work for me. I've discovered that a good diet, regular exercise, and taking time for self-care make a world of difference. Similarly, Mark, a former athlete diagnosed with osteoarthritis, shares his journey. I had to adjust my workout routine, but I didn't give up. I incorporated low-impact exercises and focused on strength training to support my joints. It's been a challenging journey, but I've learned a lot about my resilience. We also hear from Dr. Lisa Green, a nutritionist who specializes in diet plans for arthritis patients. Nutrition plays a critical role in managing arthritis, she notes. A diet rich in anti-inflammatory foods can help reduce inflammation and alleviate arthritis symptoms. Finally, we hear from Dr. Samuel Chen, an alternative medicine practitioner. Complementary therapies like acupuncture, massage, and yoga can provide additional relief and improve overall well-being, he suggests. As you can see, everyone's arthritis journey is unique. Whether you're a patient, a healthcare provider, or a loved one, these insights underscore the importance of a multifaceted approach to managing arthritis. You've got questions and we've got answers. Let's address some common questions and misconceptions about arthritis. First off, one might wonder if arthritis is an old person's disease. This is a widespread misconception. Arthritis can affect people of all ages, including children. It's not just an inevitable part of aging. Another question often asked is arthritis just minor aches and pains? The truth is, arthritis can cause severe pain and it varies from person to person. It's not something you should just live with. A common query is, can diet and exercise really help manage arthritis? Absolutely. A balanced diet and regular exercise can help reduce inflammation, improve mobility, and alleviate pain. Lastly, is there a cure for arthritis? Currently, there's no cure. However, treatment options can significantly help manage symptoms and improve quality of life. Knowledge is power, especially when it comes to managing arthritis. You're not alone in this journey. There are numerous support groups out there, filled with individuals who understand exactly what you're going through. Online communities are also a fantastic resource, offering a wealth of knowledge and experiences. There are countless resources available, from educational websites to helpful apps, that can provide additional help and information. Navigating arthritis can be challenging, but with these resources, you'll find a community ready and willing to help. Remember, support is just a click away. Arthritis is a common yet complex condition with no one-size-fits-all solution. We've delved into its causes, symptoms, and impact on daily life, explored diagnosis and treatment options, and shared tips for managing the condition. We've also introduced recommended products, expert insights, and resources for further support. Remember, while this information is informative, always seek professional advice for personalized guidance. You're unique, and your arthritis management should be too. Take control of your arthritis, don't let it control you.